everyone, and welcome to today's webinar presentation on enhancing engagement, advancing skills in virtual home visiting. My name is Sarah Carsley, and I am an applied public health science specialist at Public Health Ontario, and I have the pleasure of co-moderating today's session. Before we begin with today's presentation, I'd like to acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. I also acknowledge that Toronto is covered by the Treaty 13 signed with the Mississaugas of the Credit and the Williams Treaties signed with multiple Mississaugas and Chippewa bands. I'll now mention a few housekeeping items before we begin. This session is being recorded and will be available on the PHO website 2 weeks following the presentation. We have enabled the chat pod to encourage discussion and interactivity. If you have questions during the presentation, please use the Q&A pod. Following the presentation, there will be a discussion and question period. If at any point during the workshop you experience any technical issues, please email capacitybuilding@oahpp.ca, and a member of our team will be happy to assist you. I would now like to introduce my co-moderator for today, Dr. Susan Jack. Dr. Jack is a professor in the School of Nursing at McMaster University. She has worked in public health for over 26 years in a variety of roles: public health nurse, nurse manager, educator, and researcher. She is also the lead of the Public Health Nursing Practice Research and Education Program. Over to you, Susan.
Great. Thank you, Sarah. And good morning, everyone. It's really a pleasure to see so many of you joining us. In our work over the last couple of years, working with public health units and other programs that provide supports to parents and families in our communities, there's a few things that we've learned. Most systems have moved to using different forms of telehealth, video conferencing, texting, phone calls to do visits with families. And what we've learned is that over 2 years, everyone's gotten pretty comfortable with the technology of how to start a Zoom call or a Teams meeting. But what we continue to learn is that there's some aspects of practice that are a little bit more challenging, including how do you keep families engaged in a home visit or in an encounter with families? How do you do some of those sensitive assessments? So we pose those challenges to our speaker today to say, please, can you share some of your tips and guidance with us on how to overcome these common challenges in practice? So I'm so thrilled that Sam Lipless is able to join us today, and my pleasure to introduce Sam. So Sam is an experienced former director of large health systems turned telehealth consultant and trainer to some of North America's most respected organizations. And she has over 12 years of telehealth planning and implementation with academic and large health systems. And Sam's real-world knowledge of health systems makes her highly sought after as an advisor and a trainer. And she has been working with the Nurse Family Partnership Home Visitation Program in the US for many months now, really to support them to look at innovative solutions to using technology to connect with families. And once we saw her amazing work in the US, we said, Sam, please come up to Canada and spend an hour with us to share your tips and strategies as well with a range of clinicians working with families in the community up here in Canada. So it's my pleasure now to turn the screen over to Sam. Welcome, Sam.
Thank you so much, Susan, and I'm excited to be here, and thank you to the Public Health Ontario Network. So as Susan mentioned, Sam Lipless, I've been in the telehealth space for 12 years, and I'm excited today. We're going to talk about advanced strategies for client engagement in home visiting. Now, what I want you to keep in mind is what's really kind of interesting and funny in this particular is we're doing a webinar, right? And I'm teaching you about how to engage your clients. But a funny challenge is I can't see you or hear you. So we're going to use the chat some, we're going to use a poll feature. And then also we're not going to do heavy slides because since I can't see sort of your pace, I'm going to do some conversation. And then actually we're going to do some actual assessments using my cell phone. So through the power of technology, we're going to do a variety of things today. So let me share a couple of slides. In this webinar, what you're going to learn is these strategies to engage clients virtually and to build that client relationship. Because we know through this pandemic, some of you may have started this job during the pandemic, so your ability to be in the home has really changed. Others of you may have done this for a long time, and so just switching to this type of modality can be difficult. We're going to talk about setting those client expectations for virtual visits and different approaches of how do you engage with the infants and the children, because your home visiting program would be a side-by-side, right? And now we have this distance, this virtual distance. So how do we simulate some of that and really try to build those same connections? And then strategies around enhancing and completing our developmental assessments, mental health, and IPV screening, which we know are incredibly difficult. I'm going to show you some demonstrations of actually a home assessment. I'm going to hop on my cell phone and do that, some tactics for toddlers, I like to call it, and then actually show you a video about a demonstration of reading with baby. And these are great, these different ASQ, developmental game playing that you want to be doing within your practice. And then last, we'll do avoiding checklist interactions. So we see sometimes when things are challenging, we can revert back to sort of checklist medicine, which on our sensitive screenings can make it more difficult. So let me stop sharing my screen. And I'm going to just be on camera here for a minute, because what I want you to be watching as we do this presentation is how I am, the animation, the way I'm interacting with you, and think about that for yourself as you come into this virtual environment. So I want you not only to be listening to the content, but also watching the cadence, watching the pace, and looking at that as a way to model how you can connect with your clients. So we're going to do now a poll, because there's no right or wrong answer, but I want to have a sense of how much of your telehealth is video visits versus telephonic audio only. So if everyone can humor me and put some answers in the poll, that just helps me. There's no right or wrong answers. This, of course, is anonymous, but it does help us have a sense of the use and how much you are doing through video. So we'll give this a second here on, and then we will proceed. Let's see here, my answers. We've got about, we've got 38% over 60, 13. Okay, great. We've actually got, I'm going to tell you, Canadians, you're crushing it. Higher than we see generally in the States. So that's exciting, which allows us really to dig in more to these deeper concepts. The next thing I want to ask you is in the chat is tell me, what are some of your barriers to video visits? Because I do think it's important that we see, it's probably general trends that I see overall, but if some of you can put in the chat, what kind of barriers do you face? I want to make sure it's consistent, which it probably is, and make sure we address some of those issues. Okay, perfect. Yep, I see a lot of connectivity coming in, client comfort with being on video. A lot of connectivity, kiddos fussy, body image. Oh yeah, we're going to talk about that. That's super important. Connectivity, lots of cancellations. Okay, let me just get some basic. Okay, perfect. So these are great. So we see a lot of things about connectivity. Now that, of course, if you're in a rural area, obviously in Ontario, you're going to have broad areas that are going to have either internet or connectivity challenges. Now, those tend to be challenges that have to be fixed more at a governmental level, right? We need more access, but some of the ways we can work through connectivity, what we've seen during the pandemic, some of our public spaces like libraries or schools, or for example, in rural areas, McDonald's, they actually extend that Wi-Fi out into the parking lot. So I'm not saying, oh, you and your client should go to the library, but at times when you might want that visualization, being able to ask them to go to a place where we know that internet is being extended out into the parking lots can sometimes make a difference. It's not a fix-all, it's not perfect, but it's definitely something that can make a little bit better. Now we see a lot about parent choice and not wanting to be on camera and Zoom fatigue. So that's actually something we'll get into a little bit more. And I think if we think about that, we always want to think about also how comfortable are we on the camera? And I'll talk through some strategies. The more comfortable you are, the more likely you'll be able to convey that to your clients in a way that then those clients are like, okay, I would join you on this, right? Because same for all of us, right? If I'm feeling like I'm having a double chin today or I look terrible, the last thing I want to do is get on camera. So that can make a difference. We see a lot about multitasking, kiddos. So we'll talk a lot about that too. So this is perfect. Thank you. Those are very common themes we would be seeing throughout. I see one of the last comments here also was not seeing a full picture for the home environment. And that's perfect because we're going to demonstrate some things that you'll be able to do with that. So hopefully all of you have a pen and paper or your notes ready. I'm trying to pack a lot into this hour to be able to give really a lot of value for you. So let's kick it off. So we're going to kick off one really basic thing right now. And a lot of you are doing video. You may already know this, but I always like to review it to begin with. So first off, if we look at how I'm framed up in this frame, this is very intentional. And I want to show you what I mean. I'm making sure I have general eye contact with you. My camera's a little bit higher, but for the most part, I have myself, my own face, positioned pretty close to where the camera is so that if I'm catching my own eye, I'm making good eye contact with you. This makes a big difference on a feeling of being connected, that I'm looking at you. The other thing is how close I am. I just want you to take, even as a simple example, if I back this way up, this is kind of awkward, right? I'm there, I'm with you, but I'm a little bit farther away. I may not feel as connected. So for your client, your own getting nice in the camera view makes a big difference. The other thing, and again, these are the simple ones just to make sure everyone's got these ones already dialed in, and a lot of you probably already do. Next one is lighting, super important. I have a little tiny light in front of me that's just like $15 that clips to the desk, and you can get it off of Amazon or whoever delivers things. And you see when the light comes off, I look a little more granulated. I look a little bit darker, and that's all related to lighting. So for yourself, ideally, you want to get in a place that maybe you have some natural light coming in either from the front or the side of you. And you can also get a little light like I have here. And what you'll see is when I turn it back on, ta-da, I magic. So that's that can be little things. The other thing I mentioned, eye contact, not only looking at it, but also eye level. So my computer was sitting on a little stand, and see when it's down on my table, now this is kind of awkward, right? I'm like looking down at you. It's kind of strange. So these little things, eye contact, positioning of your laptop, and lighting. So we'll start basic, right? Those are some basic things that you can do. The other thing I really want you to keep in mind is that telehealth is only a tool to deliver clinical care. It is not a unique and distinct clinical service. And the reason we say that is your home visitor practice model is still the same. You are using a tool to provide that service. And why is that important? It's important because I want you to think about, before you go in client's home, you likely had some kind of routine, right? You prepped for your discussion. You thought about, my client's at this phase, and I know she needs to learn about this and that. And so you were prepping what you were doing. You also might be someone who wasn't 100% comfortable going in people's homes that you don't know really well. So you might have had some kind of, in your car, you might have kind of pumped yourself up, or whatever your process was. What I want you to remember is you had a routine before you went into the person's home. And think about, do you have that routine in the sense of how you're getting prepared for your telehealth visits, and what kind of routine you have before you get on video? And the reason I say that is because we had comments in here talking about Clients may be having body issues and environmental issues, but the thing is we have the same ones, right? I don't want my double chin showing up on camera. And so what you want to think about before your video visits, especially if you're someone who feels like, oh, this like really zaps my energy, this is harder for me, I don't feel so connected, is how are you prepping for it? Do you listen to music beforehand? Do you like to have a little bit of makeup on? Do you like a colorful shirt? All those things you want to think through, just like you did before you went in the home. And I think sometimes that's what's been hard in this type of communication way, is we didn't have a lot of support and training about these deeper level things. But for example, before I get on video, I like play a song, I dance around a little bit. I also know that my energy, obviously I'm already a pretty enthusiastic person, but what I know is for a video visit, my energy is going to need to be a little bit higher. So I'm bringing a little bit more animation, a little bit more higher energy to the visit. So just like you want to set yourself up for success through this prep, you want to do the same for your clients. And that's where we get into the idea of client expectations. This really speaks to everyone talking in the chat about they're distracted, they've got multiple kiddos, they might be at the grocery store, maybe they're driving in their car. And so again, go back to that idea of how did I set my expectations with clients when I came in their home? For example, they would know you were coming. They may or may not have cleaned up a little bit. You're probably not walking into a big party when you go to visit them, right? There's this idea and this sanctity and this process that the visit is a time for you to be focused. So let's give some examples of types of scripting that you can do with your clients. So for example, when we have our visits that we're doing virtually through video, please be in a quiet place where we can talk. It's great to have your baby with you so we can play some games. I know you're juggling a lot of things, but driving the car or shopping during your visit won't allow us to connect or allow me to support you, right? Like really, like why? Because they may think, I'm busy. Why is that person wanting me to be in one place? Letting them know this is how you support and connect with them. And that quiet place allows you to do that. And since we can't do this in person, next time I'd like to do a video to help you set up your sleeping area. We'll walk through your house. We can prep the area for the baby. Will that work next time for me to walk through your home using video? Again, you're prepping them for this idea. I'm coming into your home, but I'm coming there virtually. So you really want to let the client know for each of them when we're doing video and what we're doing. So if we're going to walk around the house, telling them in advance we're going to do that so that then you've set the expectation, but they've all also been able to prep their living area to be able to do that. So just like in person, letting them know what's coming the next time. For example, when we're trying to get to IPV or talking about, intimate partner violence screening, we can talk about, we like to support you in your relationships. Next time we'll talk about your relationships. It's a visit that's best when you have privacy. Will that work next time for you to be home alone? And of course, the baby with you is great. Again, these kinds of things, letting them know when we're on video, what we're going to be doing. And then another thing, for example, you can say, you mentioned you wanted examples of games and ways to play with the baby. I would love to show you read with baby. Next visit, can we hop on a video and practice with each other? Does that sound good? So just like you did in person, weaving these things into the conversation. Okay, everybody, we are going to do a home assessment with me on my cell phone. So through the power of the internet, now we're going to play with our different functions here. So give me 1 second while I mute things and unmute others. I'm going to go off camera. Give me 1 second. All right. I can hear myself in my headphones. Okay, everybody, now on your screen, my cell phone is what's big. And let me turn it around to myself for a minute.
Okay, so you're seeing me on my cell phone. My example here would be if you are connecting with your clients. Now, this is a little bit hard in a webinar because I am running solo, but if you were to practice with one of your colleagues, I want you to think about practicing and doing this as a home assessment. So let's say I'm the client, okay? I'm the client, and we've talked about that we want to look at a safe sleeping area for your baby. So at this point, it would be, Sam, I'm really excited. We know we're getting prepped for the baby. Is today still a good time to have a chance to look around where we can put the crib? Yes, that would be great. Again, I am the client. So what we can do now is actually coach our client to turn their camera around. And now we are in my house. Now, I want to give you a little bit of like physiological response for myself of what it means when I turn my camera around. Now, at first when I do it, obviously I cleaned up a bit last night. I get a little nervous of like, oh my God, what does my house look like? But once it's like this, because I'm seeing the view of my own house, I calm down a bit because I'm not on camera and I'm just looking at what's the same thing on my screen. So if we were actually guiding our client through looking at what a safe sleeping area is, we can actually come in here. And so we'd say, oh, great. Is this where you're going to set up the crib? Now, what I want you to notice right away, it's pretty dark in here, right? So we would actually coach our client, hey, if you turn on the light, I'll be able to see a little bit better. Wonderful. And then as the client's coming through, what you're actually able to see is what's going on and talking about where the crib could be placed. So if the client says, I was thinking of replacing this desk and putting the crib here, obviously some coaching would be, do we want that crib under the window? Right? You can also know there's a heater there. Is that safe for the baby to be right next to? So really using this live, it shows you a lot as you're moving around and able to see things. So again, if you've prepped your client that we're going to go look around, it gives you a much better opportunity. And to also talk about prepping the house, right? Just by being able to see, we can now have the conversation about what does it mean to have a safe area for our baby. I know another thing we do is get down on the ground and we look at eye level. So I'm literally just down with my phone, and we could even say, oh, let's look at what would the baby see? What are the things we would need to think about? So let me flip my camera back around for you. I think what's great here is it's really showing you that through some coaching, through some guiding, you can really have a different kind of experience with your clients. That if your client is just sitting like I am now, holding the phone close to my face, we forget what the other things that this tool can do. We actually can walk around the house. We can look around the house. We can do those things. And just the process of your client, you would coach them, and you would also practice with your particular video tool the correct ways to maneuver it. So I always say practice with a colleague, practice with a teenager, to be able to coach that client to turn that camera around so that now you can really take a good look at things and be able to experience that. So now let's talk for a minute about toddler tactics. So everyone said like they've got multiple kids, this is super difficult. And the kiddos being around, if you did an in-home visit, you definitely still will have a lot of those similar challenges. So again, coming back to that place of what does it mean when I'm in home and how do I manage it, definitely can be more challenging on video, but there are some different tactics we can take. So if I'm a client and I'm holding the phone like this, like I am now, you're seeing me, most likely kiddo is kind of grabbing things and it's a lot going on. One way we can help reduce some of that and get more interaction with our client and also be able to see the environment, right? Because this is one of your challenges. You're not seeing everything like you used to. So we can do a simple tactic, as I'll show you here, is if your client has a coffee table, something simple like, hey, do you have a soup can? We can just lean the phone against it. And so I'm showing you that real time. And now I could actually have now I'm the client. Remember, I'm the client. Now I can have a conversation with my client. Their hands are free. Kiddos may be running back and forth, but I've got more, my client has more freedom to have a conversation. I can also see what's going on with the kiddos. I can see what that interaction looks like. In the same kind of seating position, it also lets you see the full body of your client of what's going on. If you were doing things like if you wanted to do, for example, lactation support, you can actually have that client move up a little, being able to see what's going on and supporting them, playing games. Now you've actually got space where those kinds of things can happen. So I think a very simple tactic is really coaching your client to get that phone out of their hand and set somewhere where you can have an easier conversation. Now, you can also, if we think about toddlers, you can use a tactic of, if we think about the kitchen table, right? Forks and knives. How do I have the knife out of their arm reach, right? Some of that can be a way too, is how do I get it just enough out of the way where the kiddo is not grabbing it out of parent's hand. Another thing with kids is if the parent is connected with a headphone, that's going to be one more thing that can be a challenge for them. So I think what we find is if we can encourage our clients to get that phone directly out of their hands, it allows us to have a deeper conversation and see what's going on in their environment. Now, I am talking a bit louder because the phone is farther away from me. So of course, in that case, you would want to coach your client to do the same. So with that, now I want to be able to share a video with you. I'm going to go back over to my computer and switch back our tools. Give me 1 second. Now I'm going to share my screen and show a video. The context for this video is that this is actually a training we did where we were doing live demonstrations with our home visiting nurses. So what I want you to keep in mind here, what this actually is a live demonstration. And what you'll see is the home visiting nurse doing a read with baby example. And I also want you to pay attention that he has very intentionally set up his space to be able to do this. But this shows you an example of actually he's doing a teach, and then it would be a teach back of that reading and developmental skills. So let me share screen. And I'll teach you a little technical thing here if you don't already know it. When you go to share screen in whatever tool you're doing, whether it's Teams or Zoom or anything, if you're sharing a video, you always want to make sure you share sound also. And so that's an extra step that you want to practice and make sure you feel comfortable with that as you're doing it. And then you can always ask your people, are you hearing this, to make sure they're hearing what you're hearing. So let me press play.
With minimal support, and this is his 6 months old. He is sitting up with minimal support, and this is his favorite book. I read this book to him twice a day, usually in the morning and at night. It's sort of part of our wake up and our bedtime routine. I'll also tell my clients, like on a personal note, you know, I'm a father of 3. My oldest child is 12 years old. He's in 7th grade. I still read to my kids 3 to 4 nights a week. You know, obviously we're not reading I Love You Always anymore. Right now we're reading the Percy Jackson series. And, you know, it's been a pattern that we established when the kids were really little. And now here we are years later, it's still something that we all really enjoy. So if this is something that you find that works for you and works for your baby, this is something that really is, you know, adaptable throughout your entire parenting experience, or at least up until 12. I can vouch for that far. So anyway, so we're just, so Sam, we're gonna, I'm just gonna go through this book, a couple pages with baby Peter here. So you can just see how, you know, when you're reading a book with a baby, you're not so much concerned about the text. You're really concerned about the experience the baby is having, thinking about what they're gonna see and helping them understand what they're seeing. This is also an opportunity to bond with your baby, to help them develop a love of reading. So when, you know, when the baby, you know, when you snuggle him close, and when, well, you've got baby Grace, you know, when I snuggle Peter close and then I read to him, you know, we talk and, you know, maybe we'll sing a song or something like that. Those are all things that point him towards a love of reading. And of course, a love of reading is important to, doing well in school. So even though doing this might seem like it doesn't make sense because he's so little and he can't read, those are things that that can really have a beneficial impact on him. So we'll just start this one. I Love You Always. Peter, do you remember this book? We read this one this morning. I think you do. Do you see how there's that daddy teddy bear on the front and he's got his little baby bear? Do you see that? That's kind of like me and you. You see how they're snuggling? We like to snuggle too, don't we? So you can just talk about what you see. Wow, Peter, do you see this big tree? That looks a lot like the tree that is at our house, isn't it? And do you see the swing? Do you liked it when I put you in the little swing? I know I do. In case you ever wonder, in the busy of our days, exactly how you're loved by me, I think you'll be amazed. Let's see, Peter, what else do we see? Do you see a wolf? Do you see that wolf there? So this is kind of what it looks like, Sam. It's nothing amazing. If somebody walks in the room, you might feel mildly self-conscious because it sounds a little stupid. That's okay. Being a parent often sounds a little stupid, makes you feel a little vulnerable, and that's okay. So I love you first thing wide awake and nighttime sleepy too. And every minute in between, I love all the ways of you. Peter, do you see these animals here? Do you see that bunny? I like the bunny. Do you remember the bunny that we saw in our backyard yesterday? That was really fun. And now let's just say Peter grabbed the book and he starts chewing on it because that might happen. Hey, I've got another book right here, Sam. So so while Peter gnaws on I Love You Always, we're just gonna look at animals. And oh, look, we've got a puppy here. Can you feel the soft fur on the puppy? And so we just look at the puppy. We'll talk about, look at the baby monkey. What color is the monkey's fur? It is black, isn't it? Do we have a kitty that's black? Yes, we do. And so then if Peter grabs this and he wants to chew on this book, that's okay. We go for this one. And if Peter starts to turn away and he's not interested, he starts looking at something over here and crawls away, that's okay. This isn't a lecture on molecular physics that he needs to pay close attention to. So when we want to do things like this, of course, we're doing this for his benefit. So we want to follow his cues, look at his readiness. And when his attention starts to drift, we can follow him and let him lead. Does that make sense?
Yeah, that is really, really good. So what else? Like sometimes obviously I have a problem because she's like, always ripping my hair and things like that. What are some suggestions for that besides just putting up my hair if for some reason I couldn't do that?
I would say if you shaved your head, that would be really effective. However, if you're not willing to do that, just put your hair back on a ponytail. You've also got that necklace, I noticed. Baby will probably want to grab that necklace. If that's okay with you, that's fine. Just make sure it's not something that baby could choke on or something like that. But you're right. Lots of times babies will grab at clothes, hair especially. I know my baby did that for my wife quite a bit. So yeah, putting hair up would be a great idea. Just making sure you're not wearing anything that, if you got like a bright sequined sweater for your ugly sweater party or something like that, that's another thing to consider. Good point.
Okay, awesome. Okay, so for nurses, first of all, Adam, good job. And you're getting a lot of fanfare that we're going to go back and look in the comments here. So a couple things just to show you again, the nice thing about this coffee table thing. Now my phone has been slipping. You all may have noticed me fixing it. So I put a piece of paper under it because again, it doesn't have a stand right now. So it's super slippery. So I just want to again, call the attention to, you can see my full body, so Adam can see exactly what's happening with me. Another great thing, we're talking about pipe. If baby is grabbing my hair while we're doing this and I respond, positive, negative, Adam can coach me on that. So now that's his opportunity to coach me on positive, negative interactions. Me as a client, I will always feel more comfortable when I'm a little farther away from the camera, right? So the audio might not be as good. I'm talking a bit louder. So if once it's farther away, if you can't hear them, you can just ask them to talk a little bit louder. But for your client, they'll relax a bit more. And again, if we think about the idea of you being in person where you're next to me on the couch, this is much more of a feeling of you sort of being next to me, because I'm on the couch and, you know, Adam's got the view where I can see baby and him. So just some ideas of how I feel physiologically when we do this, is that I'm more relaxed because I'm just a little bit farther away, but you can see my whole, you know, you can see everything that's going on. And if I had people around me, you could actually see people walking by. So you get more of a sense of what's going on in my space.
One other thing I wanted to add, when I practiced this with Sam and she gave me a heads up about the soup can tip, I used that tip with a client a couple days ago. Her baby was reaching for the phone as she was trying to talk on it. And for me, I've really missed seeing my babies. You know, when I'm doing my visits, most of the time I'll see a baby for 30 seconds at most, maybe 60 seconds if they're sleeping or nursing or whatever. But having her set the phone on the coffee table so I could actually see the baby for the full visit, just like I felt so much more connected to my client, to the baby. It was such a better experience for me because I have been missing seeing my clients' babies so much. And it was like the highlight of my day, getting to see that baby.
All right. So we just wanted to share there. That was an opportunity to show a demonstration of, for example, read with baby, and love that. So here's a home visitor again who used one of those tips right away. Not only did he set himself up with being able to demonstrate what that looks like, share that with his client, but then in his own work, he went ahead and really did that coffee table trick and was able to right away be able to see his client, which made him super excited, and see that baby, because all of you are in this to connect, not be at a distance from everyone. So we're going to open up the chat here again, and I'd love to hear people up to this point. What are some of the top two takeaways that you have so far? I'd love to see some of that in the chat. I'll give it a second here. Things that maybe you've seen you didn't think that. Yeah. So I love, Amber mentioned, love the use of the doll. I think what's great here about that doll is really prepping yourself. Think about, do I have a doll? Do I, if we're talking about lactation, do I have, pardon my, like a fake boob, right? We talked about that. These different prepping yourself so that you're able to do that. Yeah, a lot of things around the doll and prepping, placement of the phone, negotiating and prepping those expectations. Soup can, hey, you guys are, I'm so happy to see these comments coming in. But I think really a lot of people are talking about that modeling and placement. Use it, right? You practice and it gets you ready, because if you don't already have it ready, it's really hard. And we can think about that same thing if we think about our IPV assessments or our challenging things. Is that really one wonderful opportunity about being virtual is we can have all our tools around us, right? Say I want to think ASQ, or I'm thinking about IPV. I can actually have these documents around me that allow me to be able to prep and be able to do that. Oh, that's so funny. I said one of the last comments here said we hadn't been able to use dolls on visits due to infection prevention because of COVID concerns. So true. But then they're saying, but no reason not to virtually, right? So there can be some benefits when you do that. And I think, so someone else talked about, I see a comment in here about the soup can and the toddler, and that the toddler could be grabbing it. I do think that can happen. I think though, sometimes if you practice, what some of the nurses and home visitors have told me is that when your client's holding your phone, like you're seeing me now, that is right. We're jealous of the phone, toddler's grabbing it. When the phone goes out of mom's hand, and now the mom can more interact with toddler and talk to you at a distance, the toddler actually can become less interested in the phone. Another tactic some of the nurses used was if the toddler was really like looking at the phone because they're looking at you as, ooh, interesting new person. Sometimes the home visitor was actually moving a bit to the side where they could still see what's on the screen and the interaction, but their own face being off the camera allowed the toddler again then just to focus on things with mom. So love that. I'm glad there's some great takeaways here in the chat, and always encourage you to scroll and see what your colleagues think. Okay, let's go a little bit into, Dana says, I mute my camera sometimes to reduce that challenge as well. Exactly. So if the toddler's really focused on you, turning off your own camera or muting it and letting them know, hey, I don't want you to feel like I'm not here with you, but I can see that baby's super excited about my face. So I'm going to turn off my camera a bit so that you can really, so I can support you and so that baby can focus on you. So that can, again, be that good way of coaching. So let's talk for a second about the harder things, such as mental health IPV screening. Now, what I want you to think for a second about is, think about how much more do you know me, Sam Lipolis, because I've been on video with you this whole time. If you had been looking at slide deck webinars and I wasn't on the screen, you would have definitely a different sense of me. And so I think what's important, if we think about that, is as we're approaching these difficult conversations, you all are doing a lot of portion of video, and I love that. And I think in your home nursing model, home visiting model, the practice does need visualization to it. There's other things on a clinical side or different kinds of care. I don't always say that video is the right tool, but we look at what your practice model is. So what I want you to think about is, by knowing me a bit more, we have a bit more of a rapport. Now, I don't have any rapport with you. Some of the people in the comments, now I feel like maybe I know you a little, but for the most part, I'm still a one-sided. And so what I want you to remember is, the more you're doing these interactions with visualization, getting to know someone, the more you can build that trust, the more you can weave in the conversations of mental health IPV. So what we know for sure is that IPV is just as hard. Well, it's harder, but it is always hard, whether it's in person or remote. Doing IPV is difficult. And what we find, and same with mental health, and what can happen is when we're out of practice with it and we're uncomfortable with it, we can resort to like checklist medicine. And so you can end up with your, you're like asking the questions, this happened, this happened, this happened. And it's not that you're not compassionate or don't care about your clients, but sometimes your own, when you haven't practiced, your confidence is down, you can go into that the same. Oh yeah, sorry. Susan just told me IPV, intimate partner violence. So, I'm actually using an acronym that I made. So intimate partner violence is when we're talking about IPV, so that intimate partner violence screening. So what I want you to always think again is going back to what your practice is in person. How did you weave in these conversations before? How did you do these different touch points? And what we know is you may be very concerned about their safety of where they are, what's going on with them. And so prepping them again, the visit before, we're going to have a conversation about relationship. We want to make sure that you're in a quiet place, that we can do that you have privacy. Some of the ways you can know if someone's there, there's no, it's not guaranteed, but you can say, hey, I don't want to leave anyone out. Is anyone there with you today? I want to be able to say hi to everyone. We've had some other nurses talk with us about, actually the clients will do it from their car. So not driving in their car, but from their car where it's a quiet place to be able to have those kinds of conversations. I think most important is that you are continuing to weave in these screenings, these questions, because what we've seen during the pandemic is that not asking is not helping us move into the place where clients can do that. I'm going to put in the chat feature here to wrap this out. Dr. Jacks, they made a wonderful downloadable link that you can, that has intimate partner violence screening and adapting that to virtual care. So we want to make sure you know where these various resources are. And really, we know it's difficult, but what we want to stress is we have these resources here. I put it not to everyone. Let me Give me 1 second. There we go. You're all like, what is she talking about? Okay, now to everyone, you can see a link in the chat that allows you to be able to download that. And that's a tip sheet and walking you through. Our message really on intimate partner violence and mental health screening is please don't stop, right? We need to keep doing that, especially at a time like now when people are more isolated. We actually have an increase in incidents. And go back to think about, how did I do this in person? How can I introduce these conversations? When we're worried about who's in that environment with them, we can ask the client if they want to do a phone call and take a walk. These different ways to get them out of their space, somewhere safe, that will be able to do it. So with that, we're at the 15 minutes before the hour. We open it up for Q&A, and my wonderful co-host is going to come back on the camera with me, and we welcome questions in the Q&A box.
Yeah, great, Sam. And people are already starting to put some questions there. And thank you for showing us that walkthrough through the house. It really felt almost like a home visit. And your role modeling of energy and animation, I already just feel that sense of how it could make people feel more engaged. So one of the first questions is, any tips on how to further engage clients when there's actually no access to video for both the client and the provider? So we do know that some health units and agencies are only able to offer a telephone call rather than video. Any quick tips for phones?
Yeah. So I think for phones, what I would do is if I have any resources, so let's say I want to do a developmental resource and I know of, let's say sleeping for baby, and I know of a, evidence-based appropriate YouTube video that I think is great to model that. I would text them that where they could watch it in advance, and then you could have a conversation about it. So what I would be doing is resources that I can email or text them that you're prepping them. I'd love to talk about these things next time. I'm going to email or text you these resources. If you could look through them, and then we'll go through it together. So I'd be trying to do it like kind of a guided conversation. Probably be using some YouTube videos and maybe some PDFs or things that I could share and walk them through.
Great, super. Thanks, Sam. And another question, how do you navigate difficult discussions with families when their preschool children are present and listening? And the goal is to try to be respectful of talking about the child in front of them and about behaviors that maybe they have been displaying. And maybe there's not an opportunity to not be with the child because they're the primary caregiver.
Okay, so one, not a clinician, and so there's where I might come back to Dr. Jack, but in terms of a logistical thing on that, one, I would go back to how do you approach this at home? When this happens to you in the home, what do you end up doing? So I'd think about it in that respect. I would also, if I knew I need to discuss something, I might ask my client if they had headphones where I could coach them and they could potentially give me yes and no answers. That allows it to have privacy without the young person in the room hearing it. That would be my logistical. Dr. Jack, from a clinical standpoint, what do we coach when they're in the home?
Yeah, that's, I think you go with your gut, right? With what's happening in the moment. Is there a way to distract them? Are they able, as a toddler, right? Can you run to your room and grab another toy? Or, can we, sometimes it's also about planning another visit, and can we schedule a visit at nap time or something, right? So it's, yeah, whatever makes sense for the client. But I love this point of really always going back to first principles. What would you do in a home situation, and ground your adaptation for telehealth or phone based on that? Great. Okay. Here's another one that's sort of similar, but I think it's a common challenge. What's a parent to do when they're dealing with a child during an encounter that's screaming, crying, and they can't hear me, and they don't have access to earbuds, and everybody's frustrated?
Yeah. So I think there's a couple different approaches here. One approach that the place I want you to start is, and we got this question a lot, and I always was like, well, what do you just leave when you're in the home and this happens? And they're like, no, I say, I'm here to support you through this. I'll sit quietly while, do they need a snack? Is it time to play a game? Some of these other things where, again, that approach is when the meltdowns at home start, you're not like, all right, I'm out of here. This seems difficult, and leave. And so it's and letting them know, I'm still here to support you. And, do we need to sing a song? Because I think sometimes with the kids, it's that, just so much is going on. And is it literally that they're hungry, they're tired, there's these other things happening? So one, can you use that time to suggest some other things happening? Can you say, hey, I see there's a lot going on, but why don't I'm just going to sit here quietly, just like I would if I was in your home, because I still want to support you. And then we can reconvene in, 5 or 10 minutes. And then of course, if it's totally out of hand, similar to being able to have that private conversation, we may say, sounds like this is just a tough time and we want to reschedule. But what I have heard from the home visitors, it's much more common in virtual where everyone's like, ooh, it's chaos, so let's hang up. But that wouldn't be what happens in person. And so letting them know, I'm here to support you. This is exactly what I'm here for. These are some of the strategies you could use. And again, are they hungry? Some of these simple things, let's play a game. So I think those things can be helpful. But of course, if it's out of hand, you're going to say, hey, it looks like you need a break and I want to honor that in you. But how can you support them through it and let them know you're not here to judge, you're here to be supportive. And if that's 5 minutes of quiet time so that they can wrangle things, perfect.
Yeah, such an important reminder of our role in support and coaching, and that these are real life situations, and that these events happen between children and toddlers and parents, and to coach and support. Okay, I love this next question. What are the pros and cons to having a screen background, either for the nurse or the client?
Mm-hmm. Okay,
I'm excited for you.
Yeah, this is like actually really, really important. And I intentionally didn't put one back here. So that blur feature that we have on Zoom, the blur feature is totally fine because it doesn't, and I'm not going to do it real time because I don't want to mess anything up. But the blur feature is cool because it's not bad. It's not like weirdly cutting me off. But what I want all of you to remember, if you have like that beautiful, like you have the tropical breeze or you have, sometimes there's a logo behind you. What happens is it's fine if you're really sitting still, but if you move or you have a phone or you have a baby or you have the fake boob or you're playing a game, that thing comes in and out and it's really weird. And what it looks like is that you have a bad video quality, when in fact, it's just the technology trying to cut the shape to have you in that background of the screen. The other thing I would say is that background of the screen for your clients can also make you think the video quality is bad because they're kind of floating in and out and in and out and in and out. So I think the blur can work well. The hardcore backgrounds, they're just technologically weird. And so that's what I think the con of them is that it can appear you're having a bad video connection when in fact it could just be that you're trying to move and the technology can't pick you up.
Great, super. Thanks, Sam. Oh, there's so many questions. It's hard. We won't get to everybody's questions, so I'm just trying to pick a few more in our last minute or two here. Based on your expertise and your experience in telehealth, do you have some suggestions around the time frame of what people can manage for a video or phone visit? What's really a manageable amount of time to be engaged?
Yeah, I think that's a really good question. It's definitely going to depend on what you're doing. I mean, I think if you were doing actively conversation plus modeling, maybe a game, I think you could get as long as that 40 minutes. I think if you're just talking, it can feel a little intense. of just talking. But if you think, but I don't want you to forget, behavioral health, mental health, mental health is very efficacious. Those are hour-long sessions. We've been doing those over a decade, and people actually can relax a bit at a distance because they're not like staring at you, getting your symptoms. So I think it really is going to depend on what you're doing. And my recommendation for you as a home visitor to feel more comfortable is to prep. Have your tools out, have your modeling out, have the things you're going to have. And that allows you to roll through it a bit easier because you're going to feel some potential stress. So I think, again, that does go back to where your clients are. And if you're just getting your client onto video and they're a bit resistant, don't start with 40 minutes, start with 15. Say, hey, at the end of this visit, I'd love to do a game, or I'd love to see how you're doing with tummy time. Do you mind if we hop on camera for the last 10 minutes so we can practice tummy time, right? Introducing it in the smaller doses, then allow you to get where you're comfortable on a screen for longer.
Great, thanks, Sam. And I'm just going to do two more quick questions. One's probably a statement. I'm seeing a few questions here about privacy laws and regulations. And because we know we have different participants today from different countries, different provinces across Canada, it's been my experience as we move to the use of texting, telephones, videos, that many organizations' policies have not kept up to date with the technology, and that we cannot provide a single answer around really how do you manage client privacy issues with the law. We can't provide a single answer today, except a recommendation for organizations to begin to look at nurses and providers' practices and review local policies and procedures to ensure that policies and procedures support clinicians to practice safely and to protect the privacy of clients. Would you agree, Sam? Like, it's really a local responsibility to say, we've got new technology. We need to make sure our policies reflect the practices of nurses and other clinicians.
Absolutely. And policies are going to vary, but that's what we would say is advocacy within your own province, countries, on what does that look like and how are we making sure we protect that privacy? Because also during public health emergencies, during pandemics, certain things can be waived and that can depend on where you are. So we really want to update those policies. Now, I will say Ontario in particular, you've had one of the oldest telehealth networks in the world. So you have a lot of telehealth in your space, which can give potentially a good model for policy and how that's handled.
Okay, great. And I'm looking here. A last tip on how we address Zoom burnout with families.
Yeah, I think, again, that's finding that right kind of time in terms of an activity. I would probably be focusing, if I know they're like, oh, I'm so tired of being on Zoom, I would really focus on, oh my gosh, I haven't seen the little one. You know how much I love to see them. Use some mom guilt, right? Like, oh, I really want to see them. Also, you can be like, oh, this is a great time for us to learn, tummy time, floor time. Make it activity-based, which will feel more fun than just staring at the screen. So I think that's a good way to get through fatigue, make it more activity-based, make it more interactive, which is building your relationship with the client and the baby.
Great, super. Oh my gosh. Oh, so many more questions, but Sam, we're at the top of the hour. I know people have busy days of practice ahead, and I just really want to thank you for spending this time with us today, sharing your tips and expertise. And thank you to everyone else for joining us as well. And I'm just truly thanking everyone for joining these webinars. It's really incredible to see such strong virtual participation, especially knowing that it is such a challenging time for healthcare professionals. Now, after this session, you can expect to receive a brief and anonymous survey for today's session. Please try to complete this. It is short. This will help us to improve our programming, and there's an opportunity to suggest other topics. So maybe we can have Sam back again if there's some more topics that you'd be interested in us having webinars on that focus on clinician work in home visiting. And lastly, to access past presentations, And to view, this upcoming session, please visit the Public Health Ontario. This presentation will be available in a couple of weeks, so the link will be available if you'd like to share it with any of your colleagues. So thank you, Sam. Thank you to my co-moderator, Sarah. Thank you to Public Health Ontario. And thank you to all of you for joining, and have an awesome day. So goodbye. Take care.
Thank you.